A mixed bag this morning when it comes to COVID. One by one, our masks are coming off, but we are also learning more about the long-term effects of COVID, or what is being called long COVID. A recent study confirming that there could be an increased risk of heart disease 12 months after people get sick with the virus. Dr. Raymond Gibbons is a cardiologist and assistant professor of medicine at Emory University. Dr. Gibbons, this is disturbing. This report suggests that millions of new cardiac cases due to COVID may be expected in the next year or so. What should people look out for if they've already had COVID?
Thank you for having me on. Yeah, so this study in Nature Medicine, just to summarize, is based upon records from the Veterans Administration medical centers. Very large database of 160 some thousand folks who were known to be infected with COVID-19, and compare it with millions of others who were not. And what they find across the board is several-fold increases in the risk of a large variety of cardiovascular disorders, from heart attacks, rhythm issues, inflammatory heart damage, and a long list. It's as we're starting to come out of our protective phase in terms of combating this disease. I think we have to be very cautious and concerned about what's going to be coming. And certainly, I will tell you, in the hospital and in the clinics, I am already seeing people with long-term effects of having had COVID-19. I think we don't even quite understand yet how big this could be, and what it's going to take to really care for folks, going forward. I would say that, given the disproportionate toll that COVID-19 has taken on, Black and Brown communities, and given historically our greater difficulty accessing adequate health care, we have to be really concerned about just the long-term burden that this will continue to have on our communities.
Dr. Gibbons, all of us gained a few extra pounds during COVID. I was walking through the airport last night, and I thought, I'm a little bit more tired than I was before COVID. How do I know the difference between long haul COVID, if I've had it? I did not. I'm just getting old. And the fact that we might have just put on more weight. In other words, what are the warning signs that people might have? Would it be shortness of breath? When should they stop and call somebody like you and say, I'm worried, I want to come back in for another test?
Yeah, so I would say, just broadly, if your level of concern is, lingering, your shortness of breath, let's say, is lasting more than, a few days, and certainly if it's out of the ordinary, that's a reason to make a call to be seen by a healthcare provider. It's worth noting that, things that are just clearly not explainable by inactivity or weight gain. You're developing chest pain that's not relenting. You're developing swelling in your feet or your ankles that is a brand new thing for you. You can't lay flat because you can't catch your breath. That's clearly not something that you can explain by age or weight gain. What I would say is, for anybody who has concern, they really ought to be seen by a healthcare provider. I think on our side, we're able to do the testing to try to understand what exactly is happening. And that would involve, whether it be with concern about heart issues, laboratory testing, echocardiograms, EKGs, a variety, and a detailed physical exam, to try to understand, if there really is evidence of heart damage here. I think it's incredibly important to be seen earlier rather than letting things linger. I have seen the effects of people, who kind of were in a bit of denial until it was, pretty late in the game, and they come in and they're extraordinarily sick. I think that's a situation we don't really want to see.
Doctor, I've only got 30 seconds left, but we are already concerned about insurance. I hear a lot of people say that if I go to the doctor and he says I have a heart ailment, there goes my insurance. Is that a concern?
It is absolutely. I think look, we had a moment, going back to the Obama administration of really trying to make sure that everybody who needs coverage gets it, and to make sure that quote unquote pre-existing conditions don't get in the way of people being able to get adequate coverage. Um, I would be less concerned about developing these types of illnesses jeopardizing your current insurance than about jeopardizing your ability to get affordable insurance going forward, and about whether your insurance adequately will cover the medications we might and procedures we might want to do for you when you have these types of conditions. I think this is a greater call once again to really revisit the issue of nationalized, healthcare coverage to make sure that every single person gets the healthcare that they need. It's really a travesty, and especially when you look at again who are the people who are not being able to access that. It really is a racial justice issue.
Yeah, it's also an issue of whether or not you want to live long or live poor. Not much of a choice at all, but living is a better option than dying. Dr. Raymond Givens is a cardiologist and assistant professor of medicine at Emory University. Doctor, thanks for being with us. You're watching DC Today.